Welcome to the Saul's Newsstand News Review for March 27, 2020. An op-ed from the 60 Plus Association Chairman James Martin states, "The moment to end surprise billing. Coronavirus has exposed a problem that's a scourge on American healthcare." Imagine returning home from China at the height of the coronavirus outbreak, only to face a bone-chilling reality. You're beginning to fall ill. This terrifying experience is precisely the situation Miami native Osmel Martinez Eskew found himself in just last month. Following a work trip to the illness-riddled region, Eskew started developing flu-like symptoms, many of which are shared between the common flu and COVID-19, better known as the coronavirus. Eskew had the presence of mind to do the right thing. He checked into Jackson Memorial Hospital and alerted the medical staff that he could potentially be infected with the coronavirus. There, he was quarantined, tested, and forced to wait for the results. The blood test thankfully provided good news. Eskew didn't have the coronavirus. He would just have to battle the flu. But unfortunately, he wasn't out of the woods yet. 2 weeks following his coronavirus scare, Eskew received more bad news in the form of a surprise medical bill totaling $3,270. His insurance agreed to cover a portion of the cost, but only if he could provide 3 years of health records to prove his flu didn't stem from a pre-existing condition. Despite already paying a sizable $180 per month for health insurance, Eskew was still on the hook for $1,400 in unexpected medical expenses. The worst part? Eskew's run-in with surprise medical billing isn't unique, and according to reports, soon his coronavirus scare won't be either. We would strongly encourage you to read the full article by clicking on the link in the description below. An article from The Federalist states, "No, we wouldn't be better off fighting coronavirus if we had Medicare for all." In the midst of a global pandemic, it's worth considering how different healthcare systems are responding to COVID-19. Italy, a country of 60 million people with universal government-run healthcare, has been brought to its knees by the overwhelming spread of the cases. Government-run healthcare may provide universal coverage, but that's an empty promise for those hospitals turn away. Anyone older than 80 isn't even being considered for treatment at this time. Here in the United States, a major contender for president, Senator Bernie Sanders, staked his platform on democratic socialism in the claim that health care is a right government should secure. Understandably, this claim resonates with many, especially those who think the alternative is for health care to be treated like any other commodity. But it shouldn't. Health care is special, often a real life or death situation. But that doesn't mean healthcare is free from the market forces of supply and demand. Saying something is a right and saying it should be free for everyone doesn't make it so. The bottom-up, entrepreneurial approach is the opposite of a top-down, one-size-fits-all Medicare for all system and would leave us better prepared for whatever other public health emergency may lie in our future. And finally, the Daily Caller reports, former representative hopes coronavirus fallout convinces U.S. to distrust Chinese tech, build up its own 5G. Supporters of a fifth-generation mobile service say that they hope China's lack of transparency on the coronavirus crisis will scare U.S. officials into recognizing that Chinese technology is a threat to U.S. national security. China's work downplaying the virus's impact makes clear that the U.S. should not rely on the communist nation to help build out 5G, former Michigan Representative Mike Rogers told the Daily Caller News Foundation. Reports show China, where coronavirus began, misled World Health Organization officials about how lethal the virus is to humans. Rogers went on to say, "We are all in trouble if politicians are still wrestling over 5G a year from now, because Beijing is not going to give up on becoming one of the largest purveyors of such technological know-how. Such strife gives China an opening as the U.S. pursues the kind of tools that help advance telemedicine, a type of technology allowing doctors and medical practitioners to provide care to patients remotely via live stream. Giving China the keys to 5G makes it more difficult to secure telemedicine for American citizens, according to Rogers. Richard Bennett, one of the original creators of the Wi-Fi system, shared Rogers' sense of urgency. Bennett told the Daily Caller, "I expect telework, teleconferencing, and telehealth will gain a permanent boost in adoption as more people learn how to use them and more organizations see their value." The response to the virus will create urgency for better Wi-Fi systems as well as ramp up 5G services, according to Bennett, who added, "I hope we can all learn something from this." And that concludes your Saul's Newsstand News Review for March 27th, 2020. For more political news faster, visit saulsnews.com.